You walked today, maybe this morning, maybe you're planning to walk this afternoon, and if you did, you felt good about it, because walking is the one thing virtually every doctor, every cardiologist, every orthopedic surgeon, every neurologist agrees on. Walk more, walk regularly, walking is medicine, and they are absolutely right. The research behind walking as a health intervention for adults over 60 is overwhelming, consistent, and genuinely impressive. But here is what those same doctors almost never follow up with, what they assume you already know, what gets left out of every brief appointment where walking gets recommended as casually as taking a vitamin. How you walk matters just as much as whether you walk. And right now, today, this morning, the way most adults over 60 are walking is quietly undoing much of the benefit they believe they are getting. Not because they aren't trying, not because they aren't consistent, but because 7 specific mistakes that feel completely natural, mistakes that feel like normal walking, are placing excess stress on joints that are already working harder than they used to, reducing cardiovascular return to a fraction of what it could be, accelerating balance decline that leads directly to falls, and in some cases creating damage that accumulates silently for months before it announces itself as an injury, a diagnosis, or an emergency room visit. I'm Dr. Sarah Mitchell. This channel is dedicated to one thing: translating the latest evidence-based research on senior health into practical, actionable information you can actually use starting today. If you haven't subscribed yet, please do that now so you never miss what we cover every week, because today we are going through all 7 of these mistakes one by one, where they come from, exactly what they are doing to your body, and precisely how to correct each one starting with your very next walk. Let's begin. Mistake number 1: walking too slowly to protect your heart. This is the mistake that surprises people most immediately, because the assumption is that any walking is good walking, and at a basic level, that is true. But when it comes to cardiovascular protection, specifically the heart and blood vessel benefits that make walking one of the most powerful longevity interventions available, pace is not optional. Pace is the mechanism. Here is the research that should permanently change how you think about your walking speed. A landmark meta-analysis published in the British Journal of Sports Medicine analyzed data from over 53,000 walkers and found that walking at a brisk pace defined as at least 3 miles per hour, or roughly 100 steps per minute, was associated with a 24% lower risk of all-cause mortality compared to slow walking. A separate analysis found that brisk walkers had a 21% lower risk of cardiovascular disease compared to their slower counterparts. Same activity, dramatically different outcomes based entirely on pace. And here is what makes this specifically critical for adults over 60. Cardiovascular adaptation, the process by which your heart becomes stronger, your blood vessels become more flexible, and your resting blood pressure improves, requires that your heart rate be elevated into a training zone during exercise, slow, leisurely. Walking does not reliably achieve that elevation in most seniors. It feels like exercise, it registers as exercise in your mind, but your cardiovascular system is not receiving the stimulus it needs to adapt and strengthen. The correction is straightforward. You do not need to run, you do not need to push into pain, you need what exercise physiologists call a moderate intensity pace, a speed at which you can still hold a conversation but feel that your breathing has meaningfully increased. If you can sing comfortably while walking, you are moving too slowly for cardiovascular benefit. If you cannot get a sentence out without gasping, you have pushed past the optimal zone. The target is the middle, slightly breathless, still speaking in short sentences, moving with purpose. Start by adding 2 to 3 brisk intervals of just 2 minutes each within your regular walk. Over 2 to 3 weeks, extend those intervals progressively. Your heart will respond. Your cardiovascular numbers will reflect it. Mistake number 2: ignoring your arm swing. Watch most seniors walk and you will notice something immediately. The arms are either hanging still at the sides, tucked close to the body, or holding a phone. This feels natural, it feels normal. It is one of the most mechanically costly habits in senior walking, and almost nobody talks about it. Your arm swing is not decorative, it is functional and deeply connected to your gait mechanics, your energy expenditure, and your balance. When your arms swing naturally in opposition to your legs, right arm forward as left leg steps forward, they perform 3 critical functions simultaneously. They counterbalance the rotational forces created by your legs, reducing the torsional load on your spine and hips. They drive additional momentum that assists forward propulsion, reducing the workload on your lower body joints. And they activate your core muscles with every stride, building the postural stability that protects your spine and keeps you upright. Research published in the Journal of Experimental Biology confirmed that arm swing reduces the metabolic cost of walking by approximately 12%. That means walking without arm swing requires 12% more energy from your body for the same distance. In practical terms, you fatigue faster, your joints absorb more impact, and your cardiovascular return is reduced, all from a habit that feels like nothing at all. The correction: on your next walk, consciously bend your elbows to approximately 90 degrees and allow your arms to swing naturally in opposition to your legs. Your right arm moves forward as your left foot steps. Your left arm moves forward as your right foot steps. Do not force it or exaggerate it. Simply unlock your arms and let the natural oppositional rhythm establish itself. Within 1 week of conscious practice, it becomes automatic again. Mistake number 3: wearing the wrong footwear. This mistake causes more cumulative joint damage in adults over 60 than almost any other single factor in daily physical activity, and it is invisible. You cannot feel it happening. The damage accumulates stride by stride, walk by walk, month by month, until it announces itself as knee pain, hip pain, plantar fasciitis, or a stress fracture. Here is what happens biomechanically when footwear is wrong for your foot type, your gait pattern, or the walking surface you use regularly. Every step you take transmits a force through your foot equal to approximately 1 to 1.5 times your body weight. Good footwear distributes that force across the entire foot structure, absorbs a meaningful percentage of the impact before it reaches your joints, and provides enough lateral stability to prevent microcorrections with every stride that fatigue your ankle and knee stabilizers. Bad footwear in this category includes many shoes that look perfectly reasonable concentrates that force. It allows your foot to roll inward or outward with each stride, a movement called overpronation or supination. It sends that unabsorbed force straight up through your ankles, into your knees, and into your hips and lower spine. A 2019 study published in the journal Arthritis Care and Research found that seniors wearing inadequate footwear during regular walking showed significantly accelerated cartilage thinning in the knee joint compared to those in properly fitted, supportive shoes. The most common footwear mistakes in seniors: canvas sneakers or flat shoes with no arch support, shoes purchased by size alone without assessing foot width or arch type, shoes worn well past their mechanical lifespan. Most walking shoes lose their supportive properties after 300 to 500 miles of use, regardless of how they look on the outside. Sandals or slippers used for neighborhood walks because they are convenient. The correction: visit a specialty running or walking shoe store where staff are trained to assess your gait pattern and recommend footwear matched to your foot mechanics. If you have already been diagnosed with arthritis in your knees or hips, ask your doctor for a referral to a podiatrist who can evaluate whether custom orthotics would meaningfully reduce your joint load during walking. Mistake number 4, the one that shocks every senior: walking without checking your medication list first. Stop for a moment, because this is the mistake nobody sees coming, and it is the one that sends the most seniors to the emergency room from what begins as a completely routine walk. Over 200 commonly prescribed medications list dizziness, balance impairment, blood pressure changes, or muscle weakness as documented side effects. 200, and the critical window when these effects are most pronounced is not random. It correlates directly with peak drug concentration in your bloodstream, which for most once-daily medications falls between 1 and 3 hours after you take your morning dose. If you take your medications at breakfast and then go for your walk 30 to 60 minutes later, you may be walking during the precise window of maximum medication effect on your blood pressure, your balance, and your muscle coordination without having any idea that is happening. The medications with the most significant documented impact on walking safety in seniors include beta blockers, which reduce your heart rate response to exertion and can cause unexpected fatigue and dizziness during exercise, alpha blockers, and certain blood pressure medications, which cause orthostatic hypotension, a rapid drop in blood pressure when you transition from sitting or standing still to walking that can cause sudden lightheadedness or fainting, diuretics which deplete potassium and can cause muscle cramping and weakness during physical activity, benzodiazepines and sleep medications which impair coordination and reaction time for hours after their intended sedative window has passed, and antidepressants from the SRI class, which in some seniors affect sodium balance and can cause a subtle but real reduction in alertness and coordination. A 2022 study published in the Journal of the American Geriatrics Society found that seniors taking 5 or more medications simultaneously had a 28% higher rate of fall-related injuries during walking compared to those on fewer medications, and the timing of medication intake relative to physical activity was identified as a modifiable risk factor, meaning this is a preventable problem. The correction: write down every medication you take and the time you take it. Bring that list to your next appointment and ask specifically, given the timing of my medications and their known side effects, when is the safest window for me to take my daily walk? This single conversation could be the most important walking-related discussion you have with your doctor this year. Mistake number 5, never varying your walking surface. If you walk the same flat sidewalk or the same treadmill belt every single day, your body has adapted to that surface so completely that a meaningful portion of the balance and stabilization benefit of walking has been eliminated. Your nervous system is no longer being challenged. Your ankle stabilizers are no longer being recruited. Your proprioceptive system, the network of sensors in your joints and muscles that tells your brain where your body is in space, is operating on autopilot. This matters enormously for fall prevention. Falls in adults over 60 most commonly occur not on the familiar flat surface of a regular walking route, but on unexpected surface variations: a slightly uneven pavement, a grassy area, a small curb, a gentle slope. The proprioceptive training that prepares your body to handle those unexpected variations only happens when you regularly expose your joints and balance system to varied surfaces and mild terrain challenges. Research published in the journal Gait and Posture found that seniors who incorporated varied surface walking, including grass, gentle gravel paths, and mild inclines, into their regular routine showed significantly better dynamic balance scores and lower fall rates over a 12-month follow-up period compared to those who exclusively used flat, predictable surfaces. The correction is simple and requires no special equipment. Once or twice per week, deliberately incorporate a different surface into your walk. A grass area in a local park, a gentle hill, a packed gravel path, a walking trail with mild natural terrain variation. Begin with short exposure, 5 to 10 minutes of varied surface within your regular walk, and increase gradually as your confidence and stability improve. Mistake number 6, skipping the warm-up completely. You open the front door, you step outside, you walk. This is how the vast majority of adults over 60 begin their daily walk, and from a musculoskeletal standpoint, it is one of the most joint-stressful things you can do. Here is the physiology. After a period of rest or sitting, your joint cartilage is relatively compressed and your synovial fluid, the lubricating fluid inside your joints, has not been adequately distributed across the joint surface. Your muscles are cool, meaning their contractile efficiency is reduced and their ability to absorb shock is diminished. Your tendons and ligaments are stiff with less elasticity than they will have after 5 minutes of gentle movement. Walking at full pace into this physiological state places immediate and repeated impact on joints that are not yet mechanically prepared for that load. Over time, this contributes to accelerated cartilage wear, increases the risk of tendon strain, and reduces the effectiveness of your hip flexors and hamstrings, the muscles most responsible for maintaining your stride length and preventing the shortened, shuffling gait pattern that is one of the strongest predictors of fall risk in older adults. A 2020 review published in the Journal of Aging and Physical Activity confirmed that a 5-minute low-intensity warm-up before walking significantly reduced reported joint pain during and after exercise in adults over 65 and improved gait quality measurements, including stride length and walking speed. The correction requires only 5 minutes. Before you step outside for your full walk, spend 5 minutes indoors doing slow marching in place, gentle heel raises, slow knee lifts, and easy ankle circles. That brief preparation warms the synovial fluid, activates the key muscle groups, and allows your tendons and ligaments to reach their optimal mechanical state before absorbing walking impact. Mistake number 7, walking without any destination for your brain. This final mistake is the one most people would never think to put on this list, and the research behind it is among the most compelling in the entire field of senior cognitive health. Walking is extraordinary for brain health. This is established, replicated, and consistent across decades of research. A study published in the Proceedings of the National Academy of Sciences found that adults who walked regularly showed increased volume in the hippocampus, the brain region most critical for memory formation, compared to sedentary adults. Walking increases blood flow to the brain, stimulates the release of brain-derived neurotrophic factor, and has been consistently associated with reduced risk of cognitive decline and dementia in adults over 60. But here is the refinement that most people miss entirely. The cognitive benefit of walking is significantly amplified when the brain is simultaneously engaged during the walk. Passive walking, the same route, the same surroundings, earbuds in, mind disengaged, delivers a fraction of the neurological stimulation of walking that incorporates Active cognitive engagement. Research published in the British Journal of Sports Medicine found that combining physical activity with cognitive challenge produced significantly greater improvements in executive function, memory, and processing speed in older adults compared to physical activity alone. This combination has been called dual-task training, and it is one of the most promising areas in dementia prevention research currently being studied. The correction does not require special equipment or a structured program. On at least half of your weekly walks, incorporate one of the following. Take a route you have never walked before, requiring active navigation and environmental observation. Listen to a podcast or audiobook that demands active processing, something educational or narrative that you have to follow closely. Walk with a friend and maintain a real conversation that requires genuine cognitive engagement. Count backwards from 300 by threes while you walk. Name every object you see that begins with a specific letter. These are not trivial suggestions, they are evidence-backed cognitive engagement. Strategies that transform a good walk into a genuinely powerful brain health intervention. Now let me pull all 7 of these together into your action plan, because knowledge without action is just information. Step 1. Time your walk correctly relative to your medications. Ask your doctor about your specific peak concentration windows. Step 2. Do your 5-minute indoor warm-up before every single walk without exception. Step 3. Check your footwear today. If you cannot remember when you bought your current walking shoes, they are almost certainly past their mechanical lifespan. Step 4. Unlock your arms, bend them to 90 degrees, let them swing, do it consciously until it becomes automatic. Step 5. Pick up your pace until your breathing is meaningfully increased but conversation is still possible. 2 to 3 brisk intervals per walk minimum. Step 6. Once or twice this week, walk on grass, a gentle trail, or any surface that is not your usual flat route. Step 7. Engage your brain on at least half your walks. New route, real conversation, active listening, or a cognitive challenge. 7 mistakes, 7 corrections, all of them beginning with your next walk. Comment below with one of 3 responses so our community can see where people are starting. Comment footwear if you know your shoes need replacing. Comment pace if you are going to push harder starting today, or comment medication if mistake number 4 is something you need to discuss with your doctor this week. I read every single comment and your responses shape what we cover next. If this kind of honest, research-backed information is what you have been looking for, subscribe to this channel. Next week I am covering 5 specific morning habits that are quietly raising your blood pressure before you even leave the house, habits that most adults over 60 have had for decades without realizing what they are doing to their cardiovascular system every single morning. That video could genuinely change your numbers. I'm Dr. Sarah Mitchell. You walked today, now walk better. Your body has been waiting for exactly this information.